good to have you coming down the road with us. We're going to head down to, the Elbow Lake area. There's a gentleman that runs around the country and tries to beat down proposals to help schools. In other words, bond issues. And he does it, he's a homeschooler. He does it all in the name of fiscal conservative, but he gets paid to do it. And we're going to talk about how he got his butt handed to him in the last attempt, which quite frankly made me smile. So I want to make sure I tell you that story. Bill Bullard also is going to join us today. He's the head of RCAF. They want to talk about country of origin labeling and what we can do when it comes to cattle. Christina Broadwell joins us right now. She's got her doctorate. In other words, Dr. Christina Broadwell. I should be saying that because she's earned that respect. Reproductive endocrinologist at Sanford Health. There, I got the word said, and I hope I didn't goof it up. Dr. Christina, good to have you coming down the road with us.
No, thank you so much. No, it was perfect. Perfect.
Can't spell it, but I said it right after practicing it 5 times. I want to talk about the CDC and it's, what it's looking at with guidance when it comes to pregnancy and COVID-19 vaccines. Obviously, they're knocking on the door in so many ways. We're looking at kids 5 to 11 now, pregnant women. What is your take on the CDC's position?
Yep. So the CDC definitely recommends vaccination for all individuals over the age of 12, and pregnant women are included in that group. I think it's also very important to note that one other reason that is emphasized and more recently emphasized is that because pregnancy appears to be one of the risk factors of having more severe illness with COVID-19 infection. It can lead to increased rate of hospitalization for women who are pregnant, need to be in the ICU. It's about 3 times the rate of those that are non-pregnant, need for mechanical ventilation. So really, it is something that COVID infection has a higher risk in pregnant individuals to develop severe disease, although the rates of these are quite low, that we really want to sort of help prevent those adverse outcomes and those very serious outcomes by promoting vaccination.
Well, I was pre-med for a week, so hang with me on this, okay? When you're pregnant and your body's doing what it does to give birth someday, it would seem to me that it's going through a lot of things. I'm a father and a grandfather, and I've seen it firsthand. And so, there's all of these people saying that when you're pregnant, you shouldn't, or prior to getting pregnant, you shouldn't. And so I just think there's a lot of misnomers out there. I think that this isn't a subject, Dr. Christina, that's been talked about that much.
Right. And I think you are correct. That also pregnancy, I think if we even look back on drug trials and other safety mechanisms for vaccines, drugs, any kind of equipment that we use in medicine, women, I think, have disproportionately not been included in those studies, and very much pregnant women have not been included in those studies. And I think I can understand maybe some of the thought process behind that, but it's very important to promote the health of a woman outside of pregnancy and while pregnant to help promote her best health, because you can't have healthy babes without healthy moms. And that's very, very important. But yes, they have been underrepresented in these research studies that have led up to the release of the COVID-19 vaccination. Now, I think what is also important is the CDC is trying to get more data in a means to correct this. They are now starting to be a part of these studies, and we're starting to collect some data through the VSafe program, through the CDC, that pregnant women who have received can be part of a registry to monitor side effects and any developmental or any sort of complications that they may have down the line. Some data has been released on this. Almost 1,000 women who were pregnant that received the vaccine. There was no increased rate of miscarriage, stillbirth, preterm delivery. It was very, very safe. And now over 5,000 pregnant women have been included in this registry. So we're trying to make up maybe for some lost time of not having some of this information. That would have been nice, I think, to have a little more proactively, but hopefully steps are being put in place to correct that.
Have you seen examples, Dr. Broadwell, of couples that have lost their baby because the mother got sick with COVID, that wasn't vaccinated? Before the vaccine came out, I contracted COVID. And the minute it came out, I rushed to get the shot as soon as I was eligible to get the shot. And so I know how bad it can be. Trust me, I wasn't on the boy, it's no big deal side of it. And so, did you or have you seen examples with your profession, which is going out and helping people have healthy babies, and you need healthy moms? Did you see examples where the mom wasn't healthy because of COVID and they lost their baby?
Yeah. I personally have not seen that. But also as a reproductive endocrinologist, we are more so kind of preconception, helping individuals become pregnant, and then really prenatal care continues with OB-GYNs kind of outside of that first trimester. So unfortunately, I am not involved in the entire care of pregnant women. It's a team effort, but I have heard from my colleagues that yes, they have been working with women that have been hospitalized, that have had significant obstetric complication with COVID infection in their pregnancy, and it's pretty devastating.
I want to talk about, because what we're really talking about is fact versus fiction, study versus not. And so there's two brothers that do not have a situation where they're going to knock on your door and say, we're having a hard time having a baby. Doctor, can you help me out? But these two men, Bobby and Billy Ford, one didn't get vaccinated, one did. Identical twins born boom, boom. Pretty much the same DNA. You can imagine it being a doctor yourself. The one that wasn't vaccinated is no longer here with us. And the reason I bring this up, doctor, is because of this. The one that's still with us runs a mechanic shop. A woman came in and said she had been vaccinated, but her husband hadn't been. And the reason he hadn't been was A, B, C, D, all the different falsehoods that you are familiar with as a physician. The brother that lived kicked her out. He's known her for a long time. And the reason that he kicked her out of his shop is because he's sick of people spreading lies. He's sick of people perpetuating lies, even if they don't believe in them, by simply saying them. And so that's like buying insurance for my next question. I'm going to bring something up that I know not to be true, but I've got to bring it up because it's out there. People are saying this, which is you cannot get pregnant once you've had the vaccine. If you've had the vaccine, it will stop you from having the ability or make it harder for you to get pregnant, which is right in your wheelhouse. What are your thoughts on that?
No, absolutely. And I think, to even kind of expand on that point, right now, life has changed dramatically in the last year and a half, and that's scary, and that's anxiety provoking. And I think people are just trying to maintain any normalcy or any control over their life that kind of feels like it's spiraling right now. And I think to find fact versus fiction, right? To kind of really know what are the facts as we know them, knowing that even in medicine, we learn a lot, we have a lot of knowledge, but I don't know everything. And medicine humbles me every day. And I do think that, information is available to everybody, but maybe the learning process of education is to figure out what makes sense and what is fact and what is fiction, to figure out kind of how to best delineate the two. And I will say this, so I have heard this many times, yes, that this rumor, or I think this falsehood of the basically taking away fertile potential or causing infertility, there is no evidence that the vaccine has any impact in that realm. This was postulated or brought to the forefront due to some similarities between a spike protein on the COVID vaccine and a protein in the early placenta. However, this area that's the same is so small, it is a minuscule area that these two resemble each other. And the research in the bench, the research in clinic has shown there is no decreased rate of pregnancy following COVID vaccine and having antibodies to that, having a COVID infection and having antibodies versus never being exposed to either. We see similar pregnancy rates in some therapies that we often perform here in the clinic. So really, there's just absolutely no data to substantiate that. However, I do think it's important to know that rates of difficulty conceiving, it can be anywhere from 1 in 8 couples have difficulties conceiving up to maybe 1 in 5, depending on different factors in their life. So it's not to say that infertility might not be something that people have to deal with after COVID vaccine, but it is not caused by the COVID vaccine.
And that was my next point, which is by the time they knock on your door, they're having a hard time having a baby. And so they're looking for any help that they can. And so then you get vaccinated. And for many people who know that individual that came and knocked on your door, see, she still isn't pregnant. See, she still isn't pregnant. And, people can use any tool they want to justify not getting vaccinated or, perpetuating the fact that, or that they can justify why they didn't. And so how hard is that? When you, a woman of science and somebody who's given, the dedication of her career to helping people have babies, to send that signal out, because then less people are going to knock on the door.
Yeah, no, absolutely. And I think, and my patients and couples that I work with that are struggling to conceive, they really are, it can be a very heartbreaking situation that they find themselves in. And in any situation like that, people are going to look back to say, what did I do to make this happen? And I think that I just want to provide that reassurance that this is not a contributing factor. And in fact, it's a way to keep you safe, to keep your relationship healthy and safe, as well as your future family and future pregnancy. And I think that although we do see that bad things can happen, we can find ourselves in situations that we never anticipated, that doesn't mean that our choice brought us there. There can be other factors that are contributing to this, and to provide them support, that emotional support is, I think, just really important and vital to the care we provide.
I'm going to take you down a road that you're not going to want me to take you, but I've got to take you down there because of a national debate that we're having now, which is, when does life begin? And so if in fact, forgetting having you answer whatever you believe that to be, the question that they're going to have is, when does this affect that baby? And the reason I ask this is because we don't have a vaccine that's been approved yet for ages 1 through 5. One actually up to 11, right? So 5 to 11. And so if that be the case, are we putting that baby in the womb in danger?
Yeah, boy, that's a great question. And I do, I think that kind of when life begins, and I think there are lots of different ways to approach that, from scientific views, religious views, and something that, again, I cannot comprehensively cover. But I do think, I also believe very strongly that every kind of woman has that autonomy of her body to keep herself healthy as well. Of course, we want to promote healthy pregnancy, but you cannot have a healthy pregnancy, a healthy child, without a healthy mom. And so I think whatever we need to do to deliver the best care to mom or to that individual carrying the pregnancy, that is absolutely what they deserve and what should be thought first and foremost.
You answered the question earlier. I just wanted them to hear it again. So, Dr. Broadwell, thank you. Thank you for what you do. You've put a smile on so many people's faces. I've had individuals that needed help from someone like you, and how their life changes when they have that baby they wanted so bad. So it must be a very rewarding job. I thank you for coming on with us.